that we want to go in. We want to make sure. So we're cleaning, we're doing pericare, which is going to be delegated to a PCT. Okay, so I'm probably going to say, okay, your PCT is already cleaned. Remove, or if you have, you've removed your gloves and everything else. Okay, so we've done our patient teaching. So you're going to come in from the very beginning with your patients. You know, hi, my name is so-and-so. I'm going to be taking out your staples today. I'm going to be doing your dressing change, catheter, whatever. Any prep work that you need to do for that, instructions. So I'm going to remove my gloves after, do hand hygiene. Okay. I'm hoping that this has everything in it. Okay, so I'm gonna open, remember, sterile feel away from you. So when you're opening your packages, away from you. Those packages, not, you're not gonna be, so you're gonna open it like this. So you're not touching it or contaminating, okay? And you're not reaching over, no reaching over, okay? Again, what's the edge I can touch? One. Yep. Okay. So I could use these gloves on here or my sterile gloves. I think I'm just going to use these gloves. There will be sterile gloves in your kit, so you don't have to mess with it. I wouldn't mess with it unless, well, we'll have new kits with gloves in them, so you don't have to worry about your sterile gloves here. Okay. And you're not going to have to worry about it for your wound care. We'll have sterile glove kits that you can use, okay? Or if you want to use yours, you can use yours. I can touch the inside of this and move it. I can't. People like to grab it, like here, and move it, and you've already contaminated. Only the inside. As long as you're not touching that 1-inch border. Okay. Fenestrated drape. No, that's the regular. I'm gonna have my PCT help me adjust her legs because she wiggled around and she's got her sheets. Yes. So
can the PCT not help you put that down?
Yeah, they can.
Okay.
And you notice I put the bed up too.
That leg does not want to get up at all.
So
can you
I can touch the inside of this. I can't, and I could have the PCT help me lift her hips, and I could slide it under.
Okay.
And I can slide it under like that. But I can't touch anywhere else. I can't touch. A lot of times people will accidentally touch their legs, or they'll be doing this kind of a thing where they're, you know,
trying to fix it.
Yeah. Only thing I can touch is here in the middle. Okay. I'm not going to worry about my fenestrated drape. I can move this. I haven't touched her peri area yet, so I'm going to get my whole kit put together here. I like to pull these out. You can leave these here like this if you want, but I just like to get it all out of the way. Everybody gets so excited to get the catheter in, they forget to take this piece off. Slowly, you don't want to do it fast, controlled, because you don't want it to fling everywhere. So I'm gonna have somebody, I can't touch that after, if somebody can pour this into that little hole right there. We'll have to use this for,
I did not mean to touch that.
We will have to use this for testing, but just, you can ask me to pour that on when it's time, okay? Normally you would squeeze out your little packet here, or sometimes what I do is I just open these up and stick them in there, but we can't use that gel on the mannequins. Now this is your preference. If you wanna set this up before or after, I like to do it before because it's easier. Okay, now this hand's committed. Okay.
I forget, are those already wet?
Yeah.
Okay.
I'm gonna do my cleaning. Labia away from you. Labia closest to you. Top to bottom, remember. And you can't let this go back together, and then down the middle. Okay. I can either bring over my box, but I can't touch anything. Okay. Have her take a deep breath. How far am I going in?
Until you see urine.
About 5 to till you see urine. Go in another inch or 2. So to make sure
urine.
And you're gonna, yeah, about 5 or 6 inches for female, 7 to 8 for male, I believe. Hold this because this will shoot out in real life. So always, I want you to hang on to this as you're going to insert your balloon. Okay. Now everybody likes to forget to take the syringe off. It's pressurized, so it's gonna come back out. So the moment you get that out, you can take your hand from there and unhook it. Okay. Check for placement. Okay. Where are we gonna hook it? I'm not gonna have you actually hook it on, but you're gonna tell me where you're gonna hook it. Inner thigh, so it's not, you're gonna have a stat lock or tape. Where do you hang this?
Below the bladder.
Yep, below the bladder.
Not on the side rails.
So on the bed frame, okay? And patient instructions.
Don't touch it.
Don't pull it out, don't touch it. If you have to get up, call me first. You're gonna be assessing this every shift with your assessment, okay? You're gonna look at urine. So you're gonna note the characteristics, how much you've gotten out, how she tolerated it, how many attempts you had to do. And
If you need a sample.
right, if you need a urine specimen, where are we gonna get that urine specimen? Because I may say, okay, go ahead and get a urine specimen. I can do that. I just put it in. I can do that from the bag. If it's been, you go out of the room, it's been 10, 15 minutes, you can't come back in and get it from the bag. It's been sitting there too long, then you're going to have to take your needleless adapter and draw it out of that port. Not this port, that's your balloon. This port. And then you're gonna remember that procedure, cleaning it, drawing it up out of there, and putting it in a specimen cup. Okay. To remove it, okay, and then also pericare after you insert it. So I'm gonna want to see how you can't just leave her like this, okay? Cleaning her up, the betadine, the gel, getting her in a comfortable position. You've done your instructions, putting the bed fully down, okay? To go to remove it, pericare, because it's gonna be gunky, goopy, nasty. So good pericare before, either you or the PCT. You're gonna want to check your orders, verify how much was inserted into the balloon. So that's another thing for documentation, is how much you inflated the balloon with, so that when the next person goes to deflate it, they only get a little bit out, only half of it. Did it break? Did it leak? What's going on here? And you don't want to go yanking that if it's half filled. And maybe it's malfunctioned or something, which hopefully I've never seen that, but. So you get it completely out. We're gonna tell the patient to take a deep breath. Going to remove it carefully so it doesn't fling and flick all the urine everywhere. Pericare again. And should be it.